Hi guys, it's Johnny, the registered dietitian from Integral Performance Physio. So last week we asked you a question whether you believe a low carb diet is better or a low fat diet is better to manage your type 2 diabetes and your weight. So let's see so far what the evidence and the science is telling us regarding both diets. So let's start talking about low fat diet first. So low fat diets so far have shown promising for glucose control for diabetes. So there are some studies have shown remissions of diabetes at 6 months mark. Now, in terms of weight loss, it is very comparable to low carb diet. There's really no one diet that's better for the other one in terms of weight loss. Now, we also suspect that most people regain their weight, regain their initial weight loss because they cannot sustain on this restrictive diet. Now, it's very important when you go on a low fat diet, you have to consult your dietitians and your doctor just to make sure that you're not missing some essential nutrient, especially like fat soluble vitamins like vitamin A, D, E, K, etc. Now, because you're on a low fat diet, you end up getting more calories and from other macronutrients like proteins and carbohydrate. So some of the study only look at the macronutrient, but doesn't necessarily look at the types of the macronutrient, the quality of the macronutrient. So let's say if you're eating lots of refined sugar, lots of white rice, right, flour, so you're not getting the full benefit of the diet versus if you're eating complex carbohydrate, whole grain, multigrain, and also like good carbohydrate, then you can have more benefits for your health from this diet. Now let's talk about low carbohydrate diet. As we know, low carbohydrate diet is quite popular now. And it does actually show very promising results for better control diabetes. Now, some studies have shown that there's remission of diabetes at 12 months mark. And also on top of that, there's evidence of lowering your cholesterol and your blood pressure. Now, in terms of weight loss, most of low carbohydrate diet has faster and greater initial weight loss compared to the low fat diet. However, at 6 months and 12 months mark, most of the patients regain their weight. And in terms of the total weight loss, it's very comparable to the low fat diet. So if you want to lose weight going on this diet, it's actually very comparable to a low fat diet. Now, in terms of long-term benefit, we're not quite sure when you go on a low fat, low carbohydrate diet, because most of these studies are done very short term, and the number of participants in these studies are relatively low. So we have to be careful, especially if you have liver disease or kidney disease or any vascular disease. We're not quite sure in terms of long term what are the health benefit or impact it will have on us. Now, when you're on a low carbohydrate diet, it's very easy to miss out fiber, vitamins, and minerals. So make sure you check with your doctor and dietitian before you go on this diet to see if you're the right person to try this diet. So I just want to answer a question that Diane posed a question on our Facebook page, and she asked, not necessarily nutrition related specifically, but one of the newer trends is intermittent fasting. What's the science behind it? So it is a very popular trend, actually. Most of my colleagues and families and friends have tried it or trying it for weight loss. Now, I came across three randomized study, and they were comparing a group of people that were put on a restrictive, calorie restricted diet versus intermittent diet. Now, the the result initially, the intermittent fasting group lost a bit more weight. However, at 6 months and 12 months mark, the weight loss really are very similar. So what's the take home message is that some people find it very easy to do intermittent fasting, and some people just find it much easier to eat smaller quantity and maybe eat smaller frequent meals. So at the end of the day, it's really based on your lifestyle. And again, there's no one size fit all. So you have to go with what's the best for you. If you think that intermittent fasting can help you lose weight and reduce your caloric intake, then you can do that. But there are some people can also managing by eating smaller amount, choosing, when you go out and choose less caloric dense food. So it's really depends on your lifestyle and your preferences.